Good afternoon. See, we've got a few participants. Still see that the participants are adding, so they've given access. Let me slowly start with welcoming everybody. So this is the 126th branch meeting. Thank you for those attending. Let's see. I'll start with, let's see, the agenda. So I have a couple of have an introduction and a couple of updates from the branch and from within UAE. That won't take more than 10 minutes, and then I give it to Gurmukh, who will do a presentation on monkeypox. I think we need a 30-minute for that. We have some additional time for questions afterwards, and then we probably close around 6:45, 6:50, latest 7 o'clock. So if you have any questions during the meeting, feel free to pop them in the chat. We will get back to you on your questions. A few updates. We had a more than very well session last month. I think we recorded at the top around 190 participants, which is just amazing. Which is very good to see that there was so much interest in the topic. I have just one slide on a couple of updates. The update that wasn't in there in the last month's session has to do with the technical guideline. I think it was not published at that moment, but I'm a keep away from that. I might have missed it as well. So there is a new technical guideline on ergonomics in office environment. That is an English version. There is no Arabic version available at the moment. But if you go to the Abu Dhabi Public Health Center website under legal requirements, then the technical guideline, there is a new guideline on ergonomics in office environments. So take notice of that and don't forget to add that in your legal register as well. And then as for the mechanism on top of the slide, I've seen a couple of WhatsApp messages back and forth on the practitioner registration. Mechanism 7 is still under development. According to the website of Abu Dhabi Public Health Center, it will be published shortly, but there's no exact date announced. And once Mechanism 7 is launched or is revised and published, that will also, at that time, the relaunch of the registration scheme, Qudrat, will also start. So at the moment, that's offline, no option for registration. So we're waiting for Mechanism 7 to be published. I will keep my eyes open, and if I hear anything, I will come back to you in that, either in a branch meeting or in the meantime via the WhatsApp groups. But do yourself a favor as well. Keep an eye on the Abu Dhabi Public Health Center website to stay informed of any changes. That's for the update on the transition from Moshad to ADOSH. A few branch updates. There are two upcoming conferences which are supported by IIRSM. The first one is the Health and Safety Saudi Forum next week in Riyadh. The second one is the Health and Safety MENA Forum in November, which is held in Dubai. There are still seats available, and there is a discounted price for IIRSM members. So if you have interest, visit the website of offsnet.com You can download the program with the speakers and decide if that might be interesting for you to attend. As the Institute celebrates their 50th anniversary, there are a couple of initiatives. So there's a new ambassadors network that will be launched. So anyone who has interest in becoming an ambassador, join the group, apply, go to the IIRSM website and apply. Let the organization know that you are interested in becoming an ambassador, and then the process will follow. And there is a free, not a fee, there's a free upgrading of membership. The fee is waived for your fellow membership for the month of September and October. So if you would like to upgrade your membership, then this is the time to do it. There is a code to be used, but that has all been shared in the WhatsApp group and on LinkedIn. So you should be able to get that information. Some training courses. Managing Health and Safety Risk, the Essentials on October 15. Managing Risk, the Essentials for September is fully booked, and there's another one in November where there are still places available. Have a look at the website for more information and register if it has your interest. The same courses continue as well in 2025. Some information on webinars and branch meetings. So there are a couple of webinars where you can list yourself. It's just register via the website. From doubt to determination, overcoming the imposter syndrome in safety on September 17. There's a influencing upwards, how to get the boardroom buy-in for your risk agenda. Sometimes that might be challenging to get your management in, but yeah, there's a webinar on September 25th. Cyber resilience on October 14. Getting to the root cause. I think that's always an interesting to get to the real root cause of any incidents. October 22nd. And then there's a Effective Leaders Create Outstanding Teams webinar on the November 7th. The colleagues of Qatar have their branch meeting next week with the topic 8 characteristics on effective leadership. Same for this. If you want to attend that meeting, which you can as member, as non-member, just same process as for this meeting. Register and you get a Zoom invite for the meeting. That also applies for the UK and Europe branch meetings. So I've listed some of them for the month of September. So there's a Southeast branch on strategic risk and crisis management, an East Anglia branch meeting on building an improvement engine, comprehensive risk management framework, a London branch focusing on mental health, and another East Anglia branch on engaging tomorrow's talent in risk and safety management. So again, visit the website, register yourself if it has your interest. If you're not able to attend any of these sessions, again, on the website and on YouTube will be the live recordings of the sessions. Next branch meetings, October 9, we have a branch meeting. We work together with Julie on getting a presenter for that from the UK. Not yet confirmed, but the moment we have this confirmed, we will send out the invites and share with you the topic. And then we have on November 13th a branch meeting as well. And again, we're a members organization. Today we got Gurmukh presenting on monkeypox, very much appreciated. One of our members that stepped up to do a presentation. Again, anybody else who wants to present on a health, safety, or risk topic, please let us know. We book you in for one of our branch meetings. Even if it's just sharing an experience and you say, I have enough, can do it in 10 minutes, that's even appreciated. So reach out to me or to the branch committee, either personally or just drop a line in the WhatsApp group and we'll get back to you. Gurmukh, for you, first of all, before you start, thank you very much for stepping up. We have seen some kind of communication in the WhatsApp group on monkeypox. There has been some updates from Dubai and Abu Dhabi on health guidelines regarding this topic. And again, I very much appreciate you taking the initiative to give us a bit more insight. It was a very actual conversation on the WhatsApp group. So very much for doing this. And I'd like to hand over to you to enlighten us a bit more on monkeypox and what we should know about it.
Thank you so much for the opportunity. Thank you.
Would you like any assistance or are you okay?
Yep, we can see it.
Oh, yeah. Thank you so much, Mr. Branco and Madam Julie. Good evening to you all. Today, the presentation is on the monkeypox. As we all travel through globally, so virus also travel globally. So on the 14th August 2024, the WHO World Health Organization announced that the ongoing increase in the monkeypox cases constituted a public health emergency of international concern under the provision of the international health regulations. The increase in cases across numerous countries in 2024 is attributed to the emergence of a new variant, clade 1b. So there are around 100,000 cases, confirmed cases of mpox due to the monkeypox virus, clade 1 and clade 2, including more than 200 deaths have been reported by the 121 countries globally, according to the WHO data. So this virus, it belongs to the Poxviridae family, and genus is Orthopox virus, which includes the variola virus that causes smallpox. It was first discovered in 1958 after 2 outbreaks in colonies of research monkeys. Hence, the name was given monkeypox. The first human case recorded in the 1970 in the Democratic Republic of Congo. The natural reservoir is believed to be rodents. So like squirrels and rats, these all are the natural reservoirs. There is data from CDC dated August 6th August 2024, which says in this 99,518 confirmed cases around the globe. And in the United Arab Emirates, 16 cases have been reported with no death. So basically around the world, it is more in the region of Americas, Europe, Africa, Western Pacific region, Southeast Asian regions, and in the Middle East, it is the lowest in the number. So more cases are in the men comparatively to the women, around 95%. So these all are the symptoms. The incubation period on average is 7 to 14 days. It ranges from 5 to 21 days, like up to 3 weeks. In this period, the person is not contagious during this incubation period. So after the incubation period, initial symptoms starts like fever, chills, muscle pain, headache, sore throat, cough, localized and generalized lymphadenopathy. Lymphadenopathy is basically the swelling of the lymph nodes. A person may be contagious during this period. Then appears the rashes after 1 to 3 days of initial symptoms and progresses through 4 stages. That is macular, papular, vesicular, and pustular before scabbing and crusting over. A person is contagious from the onset of the rash through the scab stage. So this is the time where another person can be infected. The typical rash progresses from mouth, face, arms, legs, hands, feet, including palms and soles. Whereas you might have seen in case of the chicken pox, it is basically on the chest area and in the back. However, this is not the situation with many cases currently. Once all skin lesions have scab over and scabs have fallen off, a person is no longer considered infectious. So these all illness resolve within 2 to 4 weeks. So on these slides, you can see these lesions. So lesions are well circumscribed, deep-seated. Lesions are relatively the same size and same stages of development on a single site of the body. So there is always fever before rash. The patient complains of the fever. And swelling of the lymph nodes is common. The lesions on palms and soles. Lesions are often described as painful until the healing phases when they become itchy, crusts. So as I said before, the rashes locations more in the arms, the extremities, perineal and genital areas. So these are the stages. In the first stage, the skin color is changed. So in the second stage, the lesions become little raised. In the third stage, the lesions are filled with the fluids. In the fourth stage, the lesions are filled with the pus. So that is why it is called pustules. And then the scab forms. So from the Abu Dhabi Public Health Center, there is it says that people with monkeypox can spread the disease to others as soon as symptoms appears until the rash is completely healed and a new healthy layer of the skin has formed underneath. So disease usually lasts 2 to 3 weeks. So how it spread to others? By the direct contact with the infectious lesions, scab, saliva, and potentially other body fluids of a patient with monkeypox. And it can spread by the respiratory secretions also during prolonged face-to-face contact, because the virus is there in the saliva also. On during intimate physical contact such as kissing, cuddling, or sex. Touching items. Wherever the infectious patient is touch the items, it could be clothing, linen, all other personal item previously, they touch the infectious rash or bodily fluid of a patient. It can also spread from mother to baby, from the pregnant woman. Placenta, when a patient develops monkeypox virus infection while pregnant. Patients are infectious once symptoms begin, whether prodromal or rash symptoms. Prodromal means what I told earlier, like when the patient have the symptoms, when he complains of fever, muscle ache, sore throat, back pain, swelling of the lymph nodes, etc., and remain infectious until scabs regions fall off and a fresh layer of the healthy tissue forms below. So transmission is by a close contact with animal fluids or blood. So it came from the monkey. So it can be transmitted from the animals to the human beings. Transmission through close contact with the infected person and their body fluids. As if you remember, during the COVID-19, the transmission was by the breathing, by the air. But here it is by the body fluids, contacting contaminated surfaces, which I've already said. And the transmission from one human to another is considered limited, because if personal hygiene is taken care and distance is maintained, all we will cover in the next upcoming slides. So who might be at risk for severe monkeypox? It could be more severe among the people, those who are immunocompromised. For example, if anybody is on the medication or taking chemotherapy for the cancer or have the HIV infections, and people, those who are pregnant, people with atopic dermatitis or eczema, already there is a skin infection, young children under 8 years of age, and CDC, that is Center of Disease Control and Disease and Prevention, is still researching who is at the most risk. So diagnosis is done through the testing only. Clinical recognition of the monkeypox is the first step in diagnosis, but definitely is always by the test, like RT-PCR test. When the test result come positive, then a person is called confirmed case. So there are these tests is ELISA, antigen detection test, PCR, and virus isolation by cell culture. The swabs of the lesions, fluid samples, or crusts are most appropriate for laboratory monkeypox tests. So the swabs are taken from the body fluids itself. In the COVID-19, if you remember, it was taken from the nose. But in this case, this is from the fluids. So treatment, as of now, there is no treatment approved specifically for the monkeypox virus infections. For most patients with monkeypox who have intact immune system and don't have a skin disease, supportive care and pain control will help them recover without any medical treatment. So medical treatment in most of the cases is not needed unless somebody is immunocompromised. The goal of treating mpox is to take care of the rash, manage pain, and prevent complications. Early and supportive care is important to help manage symptoms and avoid further problems. So supportive care is do Stay home and in your own room if possible. This is for the person who is suspected case or infected. Wash hands often with the soap and water or hand sanitizer, especially before or after touching sores. So these methods were even preventive methods were used during the COVID-19 also. Wear a mask and cover lesions when around other people until your rash heals. Keep skin dry and uncovered unless in a room with someone else. Avoid touching items in shared spaces and disinfect shared spaces frequently. And even the personal items like linens or clothes, it can be washed separately, and disinfectant can be used, detergent can be used. Use salt water rinses for sore in the mouth. Take 6 baths or warm baths with baking soda or Epsom salt from a body sore. And there are over-the-counter medications like Panadol, paracetamol, and ibuprofen are available to take care of the fever, to decrease the body temperature if it is risen, and for the muscle ache also. Do not pop blisters or scratchy sores, because if we pop up, the fluids will come out and it can slow healing. Moreover, it will spread the rash to the other parts of the body. Similarly, do not shave areas with the sores until scabs have healed and you have a new skin underneath. This can spread the rash to other parts of the body. Of course, this all shaving equipment should not be shared. These are personal. So complication can happen as eye infection or ocular infections, neurological complications, inflammation of the after covering of heart, myopericarditis, complications associated with the mucosal, oral, rectal, genital, and urethral lesions. Complication from uncontrolled viral spread due to moderate or severe immunocompromise, particularly advanced HIV infections, and as I told earlier also, like the person, those who are on chemotherapy or any other disease of which compromise the immunity. So treatment is there's antiviral drug called tecovirimat, also known as Tipox, which is given by the attending doctor, which can continue up to 90 days. And there are some other antiviral drugs also. So as I said about the prevention, avoid contact with people who have symptoms and have been diagnosed with the virus. Wear a face mask if you are in close contact with someone who has symptoms. So these all are the preventions. The people, those who are taking care or those who are in the family or nearby. Make sure to clean your hands regularly by washing your hands with soap and water or using a sanitizer, which we already remember because of the COVID pandemic. Avoid contact with animals that can carry the virus, including sick or dead animals, such as monkeys, rodents, and prairie dogs. Use personal protective equipment when caring for the patient with confirmed or suspected infection. So confirmed and suspected infection, we will learn in the next slides. Here, the person recommended for testing. You remember about the COVID-19, there were some requirement for the testings. Here, the requirement for the testing is within a few weeks after traveling to another country where monkeypox is being reported, and after close physical contact to a person with a similar rash or skin lesions, or who is suspected or confirmed to have monkeypox. And of course, after intimate physical or sexual contacts. So these are some recommendations from the Dubai Health Authority. It advises all physician and concerned healthcare workers to enhance and promote the early detection of the disease and adhere to the following measures. So basically it is enhance the surveillance by performing the required confirmatory RT-PCR test and immediate reporting of the lab confirmed cases to the preventive medicine section of the Dubai Health Authority. Then strictly home isolation of the cases. Now here you might remember during the COVID-19 we used to use word quarantine, and here it is isolation. So the difference between quarantine and isolation is, in the quarantine, a person movement is restricted, cannot go anywhere. Whereas in the isolation, the person is under the medical care. Either it could be by in the hospital, or if it is home quarantine, then somebody calls and asks, and all reports and symptoms are asked. That is called isolation. So initially for 10 days from the onset of the symptoms or until the rash has resolved. The following all household contacts and other close partner for timely detection of secondary cases to prevent further spread. Provide necessary counseling for the patient regarding the personal hygiene, as we discussed earlier, to avoid spreading of the disease. These isolation protocols are from Abu Dhabi Public Health Center, Department of Health, Abu Dhabi. In case of suspected cases, they should be isolated at the diagnosing healthcare facility. And the Department of Health has prepared some hospitals for these cases. Al Rahaba Hospital in the Abu Dhabi region, Alain Hospital in the Alain region, Liwa Hospital in Al Dhafra region. So definition of close contacts. You might remember the close contacts and the confirmed case during the COVID-19 also. The person who has exposed to an infected person during the infection period. So infection period starts from the symptoms up to the new skin comes under the scabs. So this is the infection. So if somebody has been in the contact with infected person, that is close contact. That is a contact which begins from the onset of source case of first symptom usually. And although some new data show that the transmission from infected person to other may occur from 1 to 4 days before onset of symptoms. But basically it is from the onset of symptoms to the new skin formed under the scabs. Suspected case, a person who is in contact of a probable or confirmed monkeypox cases in the 21 days before the onset of signs or symptoms. And so here both conditions. The person has the symptoms. So he is complaining of fever, headache, or muscle ache, or back pain, or profound weakness, or fatigue. Or the person, when he goes to the clinic, to the doctor for the treatment, if there is unexplained acute skin rash, mucosal lesions, and swollen lymph nodes, for which it is the skin lesions don't fully explain the clinical pictures of like chickenpox or herpes zoster. So this is also a suspected case. So confirmed case. So confirmed case is always which is clinically diagnosed, as well as when the laboratory tests are done and laboratory test RT-PCR is positive. That is the confirmed case. Conclusion, in the concluding, as we discussed from beginning, monkeypox is a viral disease caused by the monkeypox virus, presents with symptoms such as fever, headache, muscle aches, and a rash. Monkeypox can lead to complications such as secondary skin infections, bronchopneumonia, sepsis, encephalitis. Encephalitis is the inflammation of the brain, as well as the corneal infection, and that can result in blindness. So there is no specific clinically proven treatment for the monkeypox. Some studies are going on for vaccinations. The vaccination of the smallpox has been tried, which some study says like it is 80 to 85% effective. And of course, there is no smallpox now, which has been eradicated in 1980. So still studies are going on. Some antiviral drugs and vaccines are available for cross protection against the virus. Strict infection control measures and vaccination of the close contacts of the affected individual can help prevent and control outbreaks. So these are some references from where I have taken this data. WHO, of course, European Centre for Disease Prevention and Control, UK Health Security Agency, US Centers for Disease Control and Prevention, and of course from Dubai Health Authorities, Abu Dhabi Public Health Center. Thank you so much. Shukran. And I'll hand over to Mr. Branco now. Hello.
Yes, here. Let's see my camera on. Start my video. Yes. Thank you very much. Very insightful presentation on monkeypox. I think it's good to be aware. It's good to be prepared. I mean, let's hope it doesn't come our way in the severity. But I think it's good to have had this session. And I think it answered hopefully questions that colleagues had. I'm just checking in the in the chat box to see what it is. Can we get the slides to customize them to our own organization's processes? I'll leave that up to you. If you want to, I think we can make them available in the WhatsApp group, or for those who are interested in that. The recording will be published in the next couple of days, so that will be available for everyone. But yeah, so I think it's good to be prepared and have something similar ready for the organizations we work for. Let's see if there's.
I think the toolbox 10 talk can be made especially for the confirmed cases, for the definitions, especially. Right. Because when the health authorities, the Department of Health asked from the HSC professional, like who all are suspected cases or close contacts, or so we have to provide them the data.
Correct. Yeah. Any other questions from the members attending? Let's see. I don't see anything popping up. Okay. If there are no further questions for either me or Gurmukh, then thank you very much for your presentation. Thank you very much for sharing us with your knowledge on the topic. Very much appreciated. I just see a question popping in that caught my. Has the UAE made any announcements? I'm not sure in which case. The only thing, if it's about monkeypox, it's that as mentioned in the presentation as well, Dubai Health Authority and Abu Dhabi Public Health
Announcement
Center have
regarding-
updated their guidelines. So that's it for the moment. But yeah, keep following it in the news. If there are more cases, or if it's becoming a larger concern in the region, then definitely we will get more communication on that. If there are no further questions, then thank you all for attending, and I hope to see you in the October session. Thank you.
Thank you so much.